The following video contains content of an adult nature that may be inappropriate for some viewers. Viewer discretion is advised.
Hi, I'm Ori Hoffer. Ever since the Park City Medical Center opened, PCTV has shown you a number of features on the services offered here. Everything from orthopedics to labor and delivery to healthy eating. Today, I'm going to get a first-hand look at one of the newest services on the menu, urology, as I go in for
a vasectomy.
Dr. David Monday has been a urologist for over 20 years and recently joined the specialty clinic at the Park City Medical Center.
Well, I'm the first urologist here at Park City Medical Center, and I perform both in-office procedures and operative procedures in the operating room. Urology is really needed in any area where you have at least 30,000 people in a general vicinity, because with the aging population, the vast majority of our work is done on men. However, women are also treated, but on men as they get older. And as our population ages, we see more and more of the things that urologists take care of. And it goes from kidney stones to cancers to urinary incontinence, anything that really has to do with the urinary system or in the male ejaculatory, erectile, sexual functioning type of system. Vasectomy is done by many specialties, but the vast majority are done by urologists. And most people don't understand what the scope of a urologist entails. And we treat patients from the pediatric age group all the way into the geriatric age group.
Any number of doctors perform vasectomies, so why go see a specialist?
I've done thousands and thousands of vasectomies, and so in that history of 20 years, I bring to the office quite a bit of experience. It's changed a lot in the last 20 years, and there are certain types of innovations that have truly made it better, both for myself and for the patient. And in the vast majority, we're really talking about benefits to the patient. For myself, any new technology, just like anyone performing any type of labor that they enjoy doing, there are new innovations that are really going to take them a long time to learn those and become adept at those innovations. And the same is present in urology, with laparoscopy, with robotic surgery, with minimally invasive surgeries. All of those things are beneficial to the patient. It requires a lot of effort, a lot of practice, and that happens individually. Each urologist has to decide whether he wants to keep up with that. I personally believe that's very important for any urologist to do, to stay adept and abreast of all the new technology and offer those things to the patients. Dealing with complications in any type of surgical subspecialty is what we're trained for. Being surgeons and doing those surgical procedures really give us another step towards being able to adequately care for any complications. The nice part about vasectomy is we rarely ever see any complications. They go quite well.
That all sounds great, but we're talking about a pretty, shall we say, sensitive area here. What exactly goes on during the procedure?
And the procedure itself really only takes approximately 15 minutes to have done. There's very minimal discomfort associated with a local anesthetic. There will usually only be one small 1/4 of an inch poke in the skin to obtain access to both of the tubes, the vas, where a section is removed, tied, cauterized, and then a single stitch is put in the skin. I allow people the next day to get back to nearly normal activity.
Nearly normal?
Try not to get smacked in the area.
Okay, I'll keep that in mind. How about the reason I'm getting this done in the first place?
As far as intercourse and all other work-related activities, usually 24 to 48 hours.
And really, it's just that easy. The process has been relatively pain-free, though I do reserve the right to change my mind on that later. If you want to come see Dr. Monday or any of the other urologic specialists here at the Park City Medical Center, give them a call right here at this number. I've got a nice pack with my name on it at home. We'll see you next time.